Did you know? Over 6 million people in the United States have a chronic, incurable sexually transmitted disease, STD. And that every year another 19 million persons become newly infected with an STD. Many people think there are only two STDs, syphilis and gonorrhea. In fact, there are many other diseases that can be spread through sexual contact. Here are 10 diseases you can get through sex. Number 1. Hepatitis. Hepatitis B is a liver disease caused by a virus carried in the blood, saliva, semen, and other body fluids of an infected person. It is spread by sexual contact. It can also be passed from mother to baby around the time of delivery. Symptoms may include tiredness, poor appetite, fever, vomiting, joint pain, hives, rash, or jaundice. Hepatitis B vaccine is recommended for anyone at risk. Having oral sex after anal sexual contact can also spread hepatitis A, which is another viral liver disease. Number 2. AIDS. AIDS is the end result of infection with the virus HIV. HIV attacks the body's defense system, making the body less able to fight off infections or cancers. People with HIV may have no symptoms, or may not even know that they have HIV. To cause infection, HIV must enter the bloodstream. This can happen during anal, vaginal and oral sex, or by sharing needles with a person who has HIV. HIV can also be passed from a mother who has HIV to her baby during pregnancy, delivery, or breastfeeding. Medicines given to a woman who has HIV during pregnancy and delivery, and to her baby at birth, can greatly lower the chances of her baby becoming infected with HIV. There is no vaccine or cure for HIV, but there are medicines that can help infected people stay healthy longer. HIV testing is recommended as a routine part of a person's primary health care. If they find out they have the virus, they can start treatment early. Number 3. Gonorrhea. Gonorrhea is caused by bacteria spread from one infected person to another, during sex. It can infect the urethra in a man's penis, and the cervix in a woman's vagina, rectum and throat. In men, the disease may cause burning during urination, and discharge from the penis. Women often have no symptoms at all, and may not know they are infected, unless the disease is found during an examination. Untreated gonorrhea can cause sterility in both women and men. In women, it can lead to pelvic inflammatory disease, PID, an infection that causes severe lower abdominal pain and fever and can result in sterility or miscarriage. Infants born to women with gonorrhea can develop severe eye infections and meningitis. Number 4. Syphilis. Syphilis is caused by bacteria that enter the body through the skin, the mouth, or the anus, during sex. Within 10 to 90 days after infection, a sore may appear anywhere on the body, including on or around the genitals, the rectum, or mouth. The sore is painless and it usually heals in 2 to 3 weeks even without treatment. Sometime after the sore appears, the organism enters the bloodstream and spreads throughout the body. This may be followed by a fever, headache, swollen glands, or rash, especially on the palms of the hands, or soles of the feet. During its later stages, untreated syphilis can cause damage to the brain, heart, eyes, and other body parts. Although syphilis must be treated with antibiotics at this stage, no medicine can repair damage that syphilis has already done. In a pregnant woman, untreated syphilis can cause birth defects, and even death, to her unborn baby. It is very important for pregnant women to have a blood test for syphilis, as soon as they know they are pregnant. I believe you are getting value from this video so far. Please like and subscribe. Number 5. Herpes. Herpes is caused by a virus. It produces groups of blister-like sores on the genitals, about 2 to 14 days after a person is exposed to the virus. Sometimes a fever is present. The sores will break open and become painful, especially if they come in contact with urine. Even though the herpes sores may disappear, the virus is still present, and the source can return with little or no warning. Most people infected with genital herpes have no symptoms and do not know they have the virus. Herpes can spread even when there are no sores or signs of the disease. In fact, most transmission of herpes happens in this way. Cold sores are also a form of herpes. People with sores on the mouth or lips should not have oral sex, because this may cause genital herpes in their sex partners. A pregnant woman with genital herpes should tell her doctor. If precautions aren't taken during childbirth, herpes can cause serious damage, or even death to her baby. There is no known cure for herpes, but new drugs are helpful in treating the symptoms. Number 6. Chlamydia. Chlamydia is a bacterial infection that is very similar to gonorrhea. Men may experience burning during urination and discharge from the penis. However, up to 50% of men may have no symptoms, or the symptoms are so mild, they may be ignored. In women, chlamydia causes an inflammation of the cervix. Symptoms of this infection in women when present are mild and usually include a vaginal discharge or spotting. Untreated chlamydia can cause pelvic inflammatory disease, with pain, fever, miscarriage, and infertility in women. Infants born to women with chlamydia can develop eye infections and pneumonia. Number 7. Genital warts. Genital warts are caused by a virus called human papillomavirus, HPV in short. Most people with HPV have no obvious signs of infection. When present, visible warts usually develop on the genitals 1 to 3 months after exposure. Small warts are treated with medicine applied directly to the warts. The sexual partners of a person infected with genital warts have about a 60% chance of getting them too. Women with genital warts are urged to have a yearly pap smear, because the virus has been strongly linked with cervical cancer. Anal warts are also caused by the same virus and have been linked to anal cancer. Women and men with anal warts should be monitored by their health care provider. There is currently a vaccine that protects against genital warts. It is available for males and females aged 9 through 26. The vaccine does not prevent or treat genital warts or cervical cancer if someone is already infected. Talk with your doctor for more information. Before this video ends, here are some bonus tips for you. First tip: always use condoms. When used properly and consistently, it prevents STD. Second tip: get tested. In case you are infected already, start treatment immediately. It's better late than never. Feel free to share other STD in the comments. See you in the next video. Please subscribe for more videos like this. Thank you.